Welcome back to this week's episode of the Dubai Doctors Podcast. I'm your host, Dr. Natalia Spierings, consultant dermatologist. And this week I'm joined by the one and only Dr. Matteo Vigo, plastic surgeon, breast expert.
Yes.
But also you do lots of other kind of plastic surgery, which we're going to talk about. Now, I met Dr. Matteo back in September or August, like in the summer, because I needed my implants changed. And I was scouting around to see who I should go and see. And your name kept coming back and all the time from reputable sources. So I was like, I think he's the boob guy to go to, the boob guy in Dubai. So in September, I had my implants changed by you. And my implants were put in when I was about 30, so about 15 years ago. And they were totally intact when you took them out.
Absolutely.
They're totally fine.
Perfect. Just the position was wrong.
The position was wrong.
And of course, because when you put at the beginning, you didn't have the activity in the gym that you have right now. So being under the muscle, your muscle has been squeezed the implants for 15 years a lot of times. And so it was not in the right position. So what we did, we put them above the muscle so you can continue the training and they feel more natural now and less squished by
Yeah, because every time I flexed my pecs, now that my pecs are like bigger, it would push the implant down and out. I think that's called that has a name.
Animation.
Yeah, an animation defect. So, and I was like, what is going on with these like implants? It looked really weird. So they were under the muscle. I had that done obviously about 15 years ago. And interesting is you don't really put them under the muscle anymore.
I do in very selective cases.
Okay.
If I can avoid that, I'm more than happy.
So I used to think it was the common thing to do to put them under the muscle.
It was a trend. So in breast surgery, we have a lot of trends. Before it was only anatomical, only round, or only ergonomics, textured, smooth. It depends.
Yeah.
Now the trend, and I think the evolution of breast implants is to put above the muscle in a preservation way. So we preserve all the breast tissue, all the breast ligaments, to avoid that the implant will move around, etc. We still need some coverage. So when a patient is completely flat, we need to use the muscle.
Yes.
Otherwise, we see the implant is not nice.
Like the rippling effect. Though that doesn't happen a lot anymore.
No, because the new generation of implants doesn't give the rippling anymore. Plus, you select the patient, put subglandular, and then you have enough tissue to cover the implant. Unless the patient loses a lot of kilos, otherwise it stays quite stable over time.
Right. Okay, so we put my implant. I didn't do anything. You put my implant through the scar I had previously, but now I know that you do a lot. You at least talk a lot about the implant that can go through the axilla, through the underarm.
Yeah.
And that's called the
Mia Femtech.
Yeah. And that's like, I feel like you're the person who does it the most in Dubai. Is that right?
Yes, I was the first that when the technology was brought in the UAE, I was the first one to sign up for it because you need a specific training, a specific license to do that.
Yeah.
And I really wanted to go ahead in this way because it was something which is totally new.
Yeah, totally new.
We in breast surgery have many years of static evolution. There was nothing new, nothing that was really bringing something that is definitely different from the previous implant. So this kind of implants and the technology, it's amazing. From a 2 centimeter scar in the armpit, we can create a tunnel in the breast, put an inflatable balloon, create the space, and then with a special gun, we inject the implant. So the implant is injected, not even inserted, in 15 minutes.
Like a balloon, basically.
Yeah.
And it's injected with
this special gun, a special tool.
What's liquid?
Not a liquid, no, just air. There is an air that pushes a balloon inside the pocket, and then pushes the implant through the nozzle of this gun.
Oh, right.
And it goes straight into the pocket, 15 minutes. Local anesthesia, you go home and you...
So you're awake for it?
You can be awake. Some patients select to do a little bit of sedation because they are afraid of the hospital or the theater settings.
Kind of scary,
But patients who are a little bit braver, they do. And honestly, they say the tattoo on the chest is more painful than the procedure itself.
Who'd have a tattoo? Oh, okay. I was like, who'd have a tattoo on the chest? But so the axilla is here, underarm, and you make a 2 centimeter incision.
Yeah.
And the axilla heals really beautifully.
Absolutely.
Like,
because
weirdly,
there's no tension.
Yeah, there's no tension. So because I do surgery and remove things like cysts and things under the arm, and the scars are just like, they're not even there. So it heals.
And most of the time you have creases already from the normal skin. So I hide them in the creases so people will not...
No, like scarring.
Of course, the scarring sometimes can be badly even for best places, but it depends on the patient's case, not on the technique itself. Yeah.
Okay, so you put a probe that goes through the tissue, I guess, until you find the hairs around here, until you find where you need to put it.
Yes.
And then you put so what's in the implant? Air.
Implant is silicone. No,
Oh,
the
it's
implant is
silicone.
silicone. The implant is a traditional implant in
Right.
terms of manufacturing. The shape is different. It's a diamond implant because a very small implant. The maximum size is 195 cc, which is very small. But because it's a diamond shape, so you have a projection on both sides, it gives the effect of like a 260 to 70 cc.
Wow. No, I didn't see. You should talk about that on your Instagram because I didn't know that. So it's a diamond shape because my implants are 310s, I think.
Yes, 320,
Yeah,
I think.
320.
And
Mine's around the Motiva.
Motiva, the ergonomics too, which is the same feeling and texture of the Mia implants, but the shape is different. It's flat at the base and then round on the
Yeah.
surface. These ones are different because to achieve some volume, they need to be, and especially when you inject, you don't know how they land
Yes.
inside. So in this way, they can land either way,
doesn't
and it
matter.
will always be fine.
That's so cool.
Yeah.
But so, like, I couldn't have that, but not everyone is a candidate for this.
No,
So,
we need specific indication. So usually we have a smaller breast
okay.
with not too much laxity.
Okay. So, like a younger person.
Yes, I did also like 50, 55 years old ladies with a very amazing result.
Okay.
So it depends on the tissue quality of the patient. We don't need to have ptosis, the nipple that goes too much further down,
okay.
because in this technique, I cannot remodel the breast tissue.
Right.
Because the blind procedure, I just do it and I enhance the volume of the breast.
Right.
We don't call it augmentation, it's a breast enhancement. Okay.
Enhancement. It's a breast enhancement. Okay, fine. Yes.
The beauty of that is the recovery, which is super fast.
Super fast, yeah.
People go to work the same afternoon after the procedure.
So, it's the ultimate lunchtime procedure.
Exactly. Well, somebody called it the lunchtime boobs. I don't like it because it's still a surgical procedure. You need to take, seriously, but absolutely, it's great.
Right. Wow. So, or you have to be the right candidate with the right thing. And then if you don't like them or something, can you change the size of them, or you can't decrease the...
No, you need to change the implant.
You change the implant.
But you have the company, because they're very sure that people will like that.
Yeah.
I said we have a women choice program. So for 2 years after the procedure, you can remove them completely for free. The company will pay for everything.
Oh, right.
And you go back to your normal situation.
Right. So it doesn't... Okay, so you don't get like stretched skin. Or
No,
issue like
because the implant is so small that it doesn't give this
doesn't
kind of...
give that.
Actually, at the beginning, I thought, oh my God, maybe they are a little bit too small for my patient. I will not like it. But actually, the result is really good. And people want natural.
Yeah.
Nowadays, the trend is completely against the fake boobs, or you see the edge of the implant on top. Pamela Anderson was famous in the 90s. Now, not anymore. And she even removed
she removed
implant.
her.
So
Yeah.
it's something that people want to go unnoticed and very minimal.
So you get that upper pole fullness with this?
Yes.
Okay, because that's
But in a natural way.
in a natural way.
Especially the implant stretches the tissue in a gentle way. So at the beginning, they may be a little bit too high, overriding. I know that. But then in 1 or 2 months, they will drop down perfectly and they have beautiful results. Patients are super happy.
I think that's pretty cool. I thought, having looked at your videos and stuff and having read about it, that it is fairly minimally invasive, but I didn't realize it was that quick to do.
Yeah.
Then that's cool. So now, but if you have too much laxity, then you're not a candidate for that. You'd have to have a traditional, but even a traditional.
We are also a step in between Mia and the traditional, which is called PRESERVÉ. Which is, I call it the big sister of Mia, which is a procedure done from the submammary fold. Okay, the incision is 2 centimeters there. In the same way, put the balloon and then we squeeze in an implant, not with the gun, with the funnel, but we can have a bigger size, up to 320 cc.
Okay.
Is the ergonomics to implant the one you have? So it's the old style implant, let's say, in terms of shape. And this can be combined with the breast lifting.
Right. Okay.
And I am having amazing results. This is a bit more new. So it's 1 year that is in Dubai. I'm starting having good long-term results with the breast lifting with this implant, and patients are absolutely happy. The recovery is super fast. Patient go to work the day after is really, really
And it's a 2 centimeter incision under the breast.
Yeah.
And it's different than a standard one, because a standard one, you need a longer incision.
You need a longer incision, and then you cut the breast tissue. Here,
right.
again, you don't cut the breast tissue, apart if you do a lifting, but you cut more superficially. You don't go deep inside. So you still respect the breast anatomy,
Yeah.
giving a nice effect.
See, I didn't know it was so complicated.
It is not complicated, but you need to have a good understanding of the anatomy. And the most difficult part is to choose the right indication. When you see a patient, so I'm trying now to do also some education on my Instagram to explain, this is a patient for this is not a patient for this. People will understand a little bit more if they see themselves in one or the other picture, oh, I'm like that,
Yeah.
I can do that. Oh, no, I can. So they know a little bit better.
Yeah. Because it's annoying when you show up and you're like, I really want this. And then you're like, no, sorry.
Exactly.
But then, okay, so laxity is a big problem with, I have a lot of patients who talk to me about, what breast implant should I have. I don't, obviously this is not my area. So I'm like, well, I don't know. You should probably speak to Matteo about this. I don't know. But a lot of my patients complain about laxity and like post weight loss, post breastfeeding, laxity in the skin. But you're seeing that more now with the GLP-1s.
Yes, I decided to call, we all know the Ozempic face.
Some face.
And I decided to launch the Ozempic breast.
Okay. You trademark that?
No, I could not, so because Ozempic cannot be trademarked. So.
But yeah, so what is that? I mean, I can imagine what that looks like, but just tell us.
So it's a deflation of the breast, but because the GLP works in a very quick way, the nipple doesn't have the time to sag in this direction. So the deflation comes in this way. So we lose volume in the upper pole only, but the nipple and the old breast tissue stays up. It doesn't go down too much.
I'm trying to visualize this.
It's
as opposed to the nipple pointing down.
I can send you some visuals.
Yes, send me visuals. You can add it
in between us so you can see
Yeah.
how it deflates, but only in the upper pole. So putting an implant like PRESERVÉ or Mia, which fills mainly the upper pole, will give the restoring of the situation in very simple. People do GLP-1 because they don't want big surgeries like bariatric surgery. They don't want to put themselves in the gym too much and lose weight over months and months. They want something fast. And this is a solution also for the breast that follows the weight loss. And honestly, I've seen a lot of patients doing that and a lot of patients very satisfied because really you can give a nice result with that.
So you're looking at someone who's using Ozempic for like a 5 to 10 kilogram weight loss, maybe not like a 50 kilogram weight
Yeah,
loss.
of course.
That's
if
a whole
it's
different
50,
problem.
most of the time, all the t-shirts.
It's like everything's, it takes longer too. So if you're doing a quick weight loss, so quick meaning like, well, it depends on the person, but maybe 2 to 3 months, 5 to 10 kilograms. That, I mean, I always say to my female patients, like when you lose weight, your face goes first, then your boobs go, and then your hips and butt. So this is all, everyone wants to get smaller in their thighs.
Yeah,
but that's going to be the end. So you have to let all this go first.
Yes, exactly.
So then, yes, if you lose weight too.
And breast is what women really, because of course, push-up bra can always cover it up a little bit. But then when they were in the bikini is the moment where they feel not good.
There's not enough volume with the upper.
Because even a push-up bikini is visible as a push-up and people don't like it to show that they're pushing up. And you see that the tissue is empty. So it's pulled up, but there is no volume. So having this little plump in literally 15, 20 minutes, and then you go back home, is like going to the dentist, have a tooth cleaned,
It's like having a cleaning, having a bit of Botox. But so, I mean, I know when I go out or go somewhere, I'm always looking at people's skin. I have this like weird thing where I just can't not look at like moles or skin, especially if I'm like on a beach. I've not been to a beach for a very long time, but let's just say I always look at moles and things. Do you do that with people's boobs?
Yeah.
So that
it's professional deformation, I call it.
So you have your sunglasses on and you're like, oh, she needs some help there. But so yeah, just if you see Dr. Matteo poolside, just cover up so he doesn't judge you. No, she's not.
I'm not judging. I'm just,
looking, be like, I could help
handle
you.
my...
Yeah, here's my business card. I can help you. I always think I should do that too, but I never do that. If I see someone with terrible eczema at like a waitress or something, I'm like, I should probably tell them I can help them, but then I don't do that.
No,
it's a little bit,
I'm joking. Do that. I don't do it. But I spot them from far away.
From far away. Yeah, I can spot things from far away too. So, I mean, talking about weight loss, one of the things you do aside from boobs is that you do the post weight loss surgery. So and I've seen some of your patients post weight loss surgery, and it's quite an astounding type of surgery. I mean, how long does it take to do like a circumferential kind of body lift?
It depends from different factors, the kind of patient, the level of fat that they still have residual. If they don't have any fat, it's just skin. If they need to do the vertical scar, because sometimes the laxity is not only vertical, it's also horizontal. So you need to do the tummy tuck, but also it's called fleur de lis, so the scar that goes all the way back here. When they lose 70 kilos, most of the time you need to do that. Otherwise, you will have this, and people will still have this like effect that they can pull the skin in this direction.
Wow,
not only
like a
this,
jacket.
it's also, exactly. Okay. So you need to focus. But let's say a normal 360 body lift in my hands will take about 3.5 hours.
Oh, that's not as bad.
Not bad.
About 6 hours.
I did one time upper and lower body lift on a man that lost really 70 kilos with a fleur de lis in 5.5 hours. I'm a pretty quick surgeon because I have a rule that the less you traumatize the tissue, the faster the recovery.
Yeah.
And I know some surgeon takes 4 hours to do a blepharoplasty, and the patient have like big eyes for like 10 weeks.
Yeah.
Doesn't make sense to me. I want to be very quick. I do 20 minutes the upper blepharoplasty because it has to be, if you know what you're doing, you know the
It
anatomy.
shouldn't take
4 hours, no.
I don't think it would take me 4 hours. I don't even do the surgery.
No, it's the most important part is do not traumatize the tissue too much. Respect the anatomy. That's why all the kind of surgery now we go in preservation rhinoplasty, preservation facelifting, preservation breast, because we want to preserve the anatomy because we cause less issue to the patient. Before it was open up, doing this and that, and then the issue will come.
Right. Okay, so when you do the body lift, so there's, because I think I've seen scars going all the way to the back. Is that?
So the 360 is all around.
Yeah, so
all
literally
piece.
360.
It's like imagine a cylinder, you take a slice of a cylinder away and then you close it.
Oh God. And that's only down below. You wouldn't do it.
No. I usually do below. No, there is a reverse tummy tuck.
Oh yeah, reverse.
But in very specific cases, the results are not great. The scars is quite visible, especially in the central part because we need to connect. While lower in an underwear or in a swimwear is always covered. And then, of course, we reposition the belly button. We create a new belly button.
Oh, you have to move the belly button.
Yeah.
Oh, yeah.
Yeah. So we keep the belly button attached to the muscle, but then we pull the skin up and then we create a new hole and we attach the belly button again. So it's a new position, but it's the same belly button.
And that takes a lot of that's why you draw all over the patient before they go.
Oh, yeah. I need to. Yeah.
It's like
I need to draw when they're standing.
Yes, when they're standing.
I cannot draw when they're laying down because the anatomy completely changes. So I need to see the drawing when they're standing. And then when they lay down, I reflect what I've seen standing. Most of the time, I take the picture of the patient and I put in the operation theater. So I have the visual standing position and I know what I'm doing.
But you always have to draw on them when they're standing. Like I think you draw on me when I was standing.
Yes, absolutely.
Yeah.
100%.
And I do that too. I mark people for Botox when they're sitting and not when they're lying down.
Absolutely.
Because you can't mark them when they're lying down. And same with, when I do lip filler and stuff, I always have them sitting up. Because if they're lying down, everything's like weird.
Change.
You can't like do filler and stuff with someone lying down. Yeah, it changes everything.
We need to do when we're there in the surgery, of course, because they need to lay down.
They have to lie down, yeah.
But we know, and of course, you learn how to do the things, how to understand how it's standing and how it's laying down. Much as the breast, when you lay down, completely goes all the way around. It's totally different.
But don't you sit people up? Like if you're doing boobs, you sit them up to see what it looks like
at the end. Yes.
At the end,
yeah,
just to make sure.
I cannot have the whole time the patient standing. Apart that it's difficult to do the surgery from the if the patient is standing.
Yeah.
But also the anesthesia is not good to have a patient standing.
No, standing up.
Blood pressure, etc., needs to be laying down. It's much better.
Yeah, because you need to make sure like the nipples are pointing in the right direction, they're even and things like that. So when you do the 360, and sometimes they also need their arms and thighs done. No,
I don't do that. Yes.
Oh, you don't do that.
No.
The brachioplasty and whatever the thigh plasty
I know, of course, I know how to do it. It's part of my curriculum, but it's something that most of the time ends up in horrible scars.
Yeah.
Also, the armpit and the groin, where the scar ends, are not clean areas. And most of the time you have infection, which means opening of the wounds, scars terrible, patients complaining. It's very difficult to have a happy patient after one of these kind of procedures. So I decided not to do because I want to have, sleep at night, first of all, no complications, and something which is very smooth.
Yeah. Because the scarring is quite tremendous and the recovery is difficult. Because I've seen patients who've had this done, they can't like lift their arms up, they can't like put clothes on for weeks. It's not just like a week.
No.
It's like weeks and weeks. I had a patient who had her entire almost circumferential thigh lifted by having incisions in the groin and like in the bikini line and then pulled up. Yeah. So rather than having like an incision along the
vertical,
thigh, it was done like that. I mean, she couldn't walk for you can imagine she couldn't walk for like 6 weeks. Like it was completely not functional. And the dehiscence, I think, risk is very high. Like the dehiscence is tearing of or breaking up of it's opening of the scar or wound area. And I just think, it's a very brutal surgery almost.
It is sometimes necessary. But again, I prefer not to do. While the 360 body lift, my scars rarely open. It's it's done properly. If the patient follows the instruction, they don't have a pet at home that will jump on the scar because I've seen also that.
Really? Oh God.
Yeah. Or have unqualified personnel that is doing the disinfection with bare hands and then can cause problem, of course. But If they follow instruction, usually the scarring, and
fine.
we all know our friend Cassie,
Cassie,
that
yeah.
is the one who introduced us actually.
Yes, she introduced us. Yeah.
And she's a wound care specialist, and she does a lot of my patient for the follow-up massages, scar treatment, etc. And with her, of course, the chance of having a good scar is even higher.
Yeah, having a good scar is very high, which is always important. One thing I do see my patients also talk about is when they've had implants and or lifts done. I don't know why patients talk to me all about their plastic surgery. It's like I feel like I know so much about plastic surgery just through when patients talk to me. So, and the problem that I see quite often is that they get like a dog ear at the lateral aspect. And I get patients have asked me to correct the dog ear. And I'm like, no, don't worry. I've never done it. This is not my territory. Because to correct a dog ear, you have to make the incision longer. At least that's how I'm trained to do that.
Yeah, because imagine when you do massive breast lifting or massive breast reduction, of course, you have the two edges of the wound, which are not the same length.
Yeah.
So you need to try to shrink it, or you do a super long scar from the beginning. So sometimes it's even better to leave a little bit of dog ear to keep the scar shorter. And then in 6 months, you just redo, you elongate 1 centimeter, not too much.
Not too much, yeah.
But it's not the 3, 4, 5 centimeters that you've done at the beginning to make it completely perfect. And that's what I always tell the patients, that a little bit of a dog ear, especially in the breast with the bra, is always, quite conserved, not very visible from the outside. So bear with that, because it's much better to have a long scar that goes all the way here and you have for the rest of your life.
Yeah, for the rest of, I mean, I had one patient who had her dog ears corrected and her scar now goes it goes beyond her kind of bra line. And then also medially, it goes like towards her like sternal side. So it's super long. And she asked me, what can I do about the scar, the medial scar specifically, but it's a white scar. So there isn't much
to do
I can do about that. So I talked about medical tattooing, and that's pretty much all I can suggest, because that scar is there. And that was an attempt to correct a dog ear, though I don't see how that can be medial. Can you get a dog ear medial?
Yeah.
Oh, you can? There's not a lot. There's not so much.
For the way I do my breast lifting or breast reduction, I always try to, if I have to leave a dog ear because I want to keep the scar shorter, I'll do laterally. Definitely.
Yeah, laterally.
Medially, I want to keep the scar as shorter and far away from the sternum for 2 reasons. It's visible.
Yeah.
And second, the closer you go to the sternum, the highest the risk of keloid.
Oh, yeah, of course, keloid scar, because of the tension.
Because there is no subcutaneous tissue yet with the sternum. That's why I want to keep them as far as I can. And then on the lateral, I can leave a little bit of dog ear. I don't mind. Even in the abdomen, I sometimes, to avoid the scar to be too long, I sometimes leave a little bit of dog ear. I said 6 months, just local anesthesia procedure. I cut it and I remove it, but at least you have nicer results and a shorter scar.
Right. Okay.
You cannot have everything,
You can't. Well, yeah, that's the thing. It is a limit to how much you can do. Now, you also do facial stuff too.
Yeah, I do. The only thing I don't do is rhinoplasties.
Right. Okay. Yeah.
I love doing blepharoplasty, upper and lower. It's one of my favorite because it's something that is so minimal, so quick, and gives such an impressive result to the patient. They really see themselves changed. I do a lot of facelifting as well, neck lifting, autoplasty, so for the prominent ears.
Ear pinning. Autoplasties are ear pinning.
Yeah, exactly. Exactly.
Autoplasty. Yeah. So it's a weird.
And what else I do? Lip lifting when the bullhorn.
You do it with the philtrum, the cutting not the philtrum, right under the columella.
Exactly.
And making that lip shorter.
Shorter and inverting them so they look bigger without having to use the filler, and it's a permanent solution.
See, I think the scar looks weird.
It depends. It can be weird. And again, scar is something that I put black on white. I don't guarantee on your scars.
Yeah.
Because
no,
I cannot.
You can. I mean, I've seen this little scars from the lip lifting, not your patients, where it's stretched a bit and it kind of looks weird. And the shortened philtrum, I sometimes think looks odd. You have to be really careful with patient selection for that procedure, because
Absolutely.
They have to have the right shape or a long enough philtrum where it's not going to look weird if they have like a short.
No, you need to balance the measurement that you take exactly to calculate with the length of the philtrum before the surgery, how much skin you have to remove. We calculate that with a specific formula in order to have the exact amount to give the right.
How do patients know they need that surgery? Because I've never looked at my upper lip and thought, it should be shorter. Like,
Some patients are on social media,
Social media.
and they see,
Thank you, social media.
maybe I can have this, because then they see the influencer that did it. And I said, I can do that. So they go and look at themselves in the mirror and say, oh, yes, I might look better. And they start pulling their face.
Yeah, pulling everything up. Yeah.
Yeah. Now, of course, the trend is about the facelifting.
Yes.
With the Kardashians' mom,
Since
since that, and everybody is booming. Really, people want this kind, and then everybody talk about the deep plane, and they don't know what is a deep plane. So,
yeah,
I want a deep plane, and I said, "What is a deep plane?" I don't know, but I want it.
Yeah, I don't know what it is either. To be honest, I don't know what a deep. I have a patient say to me, "Yeah, but does that? If I recommend someone for a facelift, like the surgeon, like does he or she do deep plane facelifts?" I'm like, I have no idea, but the results, whatever that surgeon does, is great. So just ask them. But does it? I mean, I don't know, because I don't know what a deep plane.
But you have the layers, you have the skin layer, and then you have this mass under the which is the musculoponeurotic layer, and the deep plane goes under this layer and pulls the layer up. Okay, which is of course ideally more effective.
Okay,
but it's also more dangerous, because under the layer we have the nerves.
Yes.
So we need to be really careful. It need to be done by a surgeon who has enough training and experience. Plus, in a very skinny patient, is not good, because you see that lower layer which is pulled. It's better to do just the superficial facelift. There are indications, and it is not one recipe for everything for every patient. And what I like is to personalize my treatment for one patient or the other, and give different results for each of them.
Yeah, but facelift is so personal that what worked for a Kris Jenner is almost certainly not going to work for me.
For me, exactly, absolutely.
I mean, that's like.
And now I see a lot of this eyebrow lifting, that they pull the eyebrow like aliens.
Yeah, like the side.
And it's something I really cannot tolerate. I was in a conference recently in Rome about that, and they were talking about, and it was a great surgeon. He does amazing results, but he's convinced that the eyebrow like that looks beautiful. So the mid face and lower face looks phenomenal. The upper face, I don't like it.
Like.
Yes.
I think I saw that on your Instagram, that you went to a conference.
Pull like this, but even the eye, because they take the orbicularis and they pull the orbicularis like that. It's really like alien eyes. And
they pull the orbicularis muscle?
Yes.
How do you, what? And how do you like attach it?
To the temporalis fascia.
Like with a stitch?
Yes.
Is that long lasting?
Yeah, absolutely.
Oh.
Then of course there is a little rebound. So the alien look doesn't last more than 3 months, but in 3 months, you don't look great. No. Then you might settle a little bit, it becomes more natural, but still you have 3 months where you look like not good.
And they go through the scalp?
It depends. They can go from here, and they go superficially, and they go deep to the orbicularis, and they take the orbicularis, they resect the orbicularis, and they pull it up.
That sounds horrifically terrible. I wouldn't recommend that to anyone, but that sounds terrible. But I do think that, what was I going to say? When patients ask me like what plastic surgeon should I see, I'm like, well, I think the most important thing is scar placement, and to understand where that surgeon is going to place their scar. And if I was going to have a facelift, which I probably will at some point, so you might see me knocking on your door again. Not anytime soon, though. Not anytime soon. I think I'm okay right now. Is the thing I'm going to ask the most about is where are these scars going? Because that's what to me that makes it, besides some tightness and things like that. But to me, the scar placement makes or breaks a facelift. If the scars are put in a weird place, I've seen scars like down the hairline here from a neck lift, from a facelift.
It needs to be there.
What? It needs to be there? Yeah, but not visible at the hairline.
I mean, it should be at the edge of the hairline. It needs to be very really good place. But sometimes you need to work also what you have. You cannot think that you can pull the skin all the way around so you can really hide very high. So you need to balance.
Oh God. No, if you told me I needed a scar here, I'd say no. Because that means you can't really wear your hair up because you can see it.
Yeah.
Yeah, that would make me not go for a facelift. So if I had to have that kind of thing, I probably would suck it up and just say, no, thank you. I'll just stick with what I have. But I also kind of think that just like when patients come to me for filler or for Botox or whatever, my personal aesthetic becomes really important. Because like you said, the surgeon in Rome, he likes that look on women, and I see work from other plastic surgeons like on Instagram, just like everyone else. And there's certain looks where you're like, that surgeon likes that look. And whenever they do boobs or whatever, you have a repetitive look. It's a signature look. And it's their aesthetic and not, for example, the patient's aesthetic. So I think when you're choosing someone to do anything to your face or your body, it's understanding what their aesthetic is. I think the only way to know that is by looking at their previous work, to understand what your kind of look is.
And the other thing, very important, that I think working in Dubai gives us this privilege that we have different nationalities, different cultures, different idea of beauty. When I moved here, I remember the first surgery was a liposuction, and I did like the hips straight like they like in Italy.
Yeah.
The patient asked me to put the fat back.
Oh no.
She was not happy because here they like the curvy style of the hips.
Yeah.
And I didn't know at the time.
No.
It was like 15 years ago. I didn't know that time. I said, oh my God, what did I do? Now I know that if I have an Arabic patient, I need to act in a certain way. If I have a European patient, South American patient, Australian, South African, different nationalities really want something different. So that's why I'm going in one direction or the other.
Yeah, no, totally. But you also, I think that makes a lot of sense, but you also wouldn't necessarily do something that you don't find attractive. Would you do something that you don't find? No, so that's the thing. So I won't either. I won't do something to a patient where I think it won't look good to me. Though that's a very personal, that's our like aesthetic.
And also is the honesty of a doctor that instead of encash some extra money to say, no, I'm not the right person
Yeah,
for
I'm not
you.
the, and I've said that number, like I'm not the right, you can find someone else to do this because I cannot do something to someone that I think looks bad.
Also because remember, our patients are our business cards.
Yeah.
If you see someone walking the street with blue lips, with this alien look, say, oh, who is your surgeon? I'm staying
Yeah,
away
I'll stay away from that surgeon.
Well, if you do something subtle, natural, etc., oh, I'm going to him or to her,
Yeah.
because that's the goal. So
Yeah, totally.
that's very important. We need to respect the patient anatomy. You don't have to do stamp faces, stamp boobs everywhere. Do something which is exactly for that body, that patient, that face, and this will look good on them.
Yeah, and it's like what kind of we think looks good, and that's why I think like you're into like design and like external to our jobs. Like I quite like interior design, and I'm quite into like how things look and are put together. And I think that makes me better at my job because I have I have an aesthetic sense that not everyone has, and I think you probably have that too. Where
exactly.
you like to dress a certain way, you like things to look a certain way. I need things to be kind of done a certain way, and then I'm happy with it. And if it's not done right, then I'm like annoyed. But I don't think everyone has that. But I think if you work in an aesthetic field where you're dealing with how people look, having that type of sensibility is important.
Yeah, definitely, 100%.
Yeah, I think that's
yeah.
Cool. All right, I think that is actually the end of our time. Thank you so much for that very
My
interesting
pleasure.
discussion about stuff. Please comment down below. Thank you so much for coming on for having me on your podcast today. Thank you for being on the podcast. Thanks guys for watching. Please put your comments below and like and subscribe, and we'll talk to you again next week.